Good morning, everyone. I can see a lot of people here, and so we are going to talk about maybe around half an hour or 45 minutes here. Actually, when Dr. Kiur came and he asked me that let us do a webinar on cancer, I was actually very reluctant about it to start off with, because I was not aware that so many people might come and if they want to listen. But looking at the response, there was a really overwhelming response over it. So this made me think. Yesterday I was thinking about it, that this topic is such, right, which is so rampant right now, and so many people want to listen to the talks that we are having anywhere. If there's a cancer talk, people go and they want to listen about it. So what is it exactly, right? What is the reason behind this, that people are so eager to know so many things about it? By the way, I can see lot many doctors enrolled here, and but of course, generally this talk is especially for people who are non-doctors. It's a layman talk, right? But I really like if doctors are really there. I would love to chat with them. But my primary talk, the 80% of my talk is going to be a general talk, which I'm going to talk as if I'm talking to lay people, okay, non people, non homeopaths or non doctors, basically. So when I was thinking about this yesterday, what came to my mind is that there are many diseases. There are many diseases that we are suffering, and that's captured the world, and human suffering is there. Cancer is one of the disease which is said maybe approximately it is the second. It comes on second number if we count the number of deaths that happen all over the world. Lot many researches have been going on: chemotherapy, radiotherapy, target therapies. So many new things are coming about. And this disease is such that generally we are very reluctant to talk about it or discuss about it unless and until you have seen a patient of cancer suffering. Maybe your relative, your friend, your close buddies. I have been working on these kinds of patients and working with Dr. Sarkar and other senior colleagues here for more than 7-8 years. And what I have seen is that it is not the patient only who suffers with cancer. It is the entire family who starts suffering with cancer. And for a doctor, even for a doctor like us or physicians who are treating, it is not easy to tackle these cases. But of course, there is a lot of negativity. With every negativity, there is a positivity, and there's a ray of hope always in life. So what we are here to talk about is basically what homeopathy can do. That is, I think, the topic, right? Awareness about what homeopathy can do in cancer cases. So let me come to the questions. Okay. By the way, before I begin my talk, I would like to tell you that I'm not here to brag about homeopathy. I'm not here to tell you that, all the patients who come to homeopathy get 100% results. No. I'm here to just share you some of my experiences which I have gone through it. And let us see if it can help some of the patients. And if it is done properly at a right time, or even in between stages, there is a lot of benefits. That is what we are going to look about. Awareness. Why should we get aware about this topic? I feel that it is very important to get aware of this topic because maybe I am handling cancer cases, but let me tell you frankly, by looking the scenario in the world, the way disease is spreading so fast, it's like a monster, right? Sometimes I also get feared that, if something happens to me or my family. So it is a social responsibility with everybody that we should be aware of all the methods, not only homeopathy, even if there's any other thing that can help people, you should be aware, because the time when somebody starts suffering from cancer, it's a very difficult time for the family and to take a decision, right decision. So today we are going to talk about, what I'm going to discuss is basically what homeopathy can do. Is there any ray of hope, or what should we expect from homeopathy? Yeah. Explain. So first we'll talk about the questions. There are many questions that we have, especially when we talk about homeopathy. So what are the questions that you deal with? Or what are the questions that you have in your mind? The first question is that, can homeopathy cure cancers? Can homeopathy really cure cancer? Do we have any ray of hope? Can it be done? Surely. We will talk about it. Another question is, forget about the cure. If you would have seen patients in the end stages where there are morphine patches given, injections given, and stops working. The pain and agony that is there in the last stages is really terrible. So is there any hope that in the dying stage, is there any hope that as a palliative care, can homeopathy be a second line of treatment? Is there any possibility? Can we look for that? That could be one of the questions. As cancer is increasing, chemotherapy is also increasing. Different combinations are coming. I'm not going to talk about the benefits and disadvantage of chemotherapy or radiotherapy. I'm not going to talk about whether you should take or not, but rather we get many patients who go through these therapies. And if you have seen these patients, more than the disease, it is said sometimes the chemotherapy itself kills the patient. Patient dies because of the side effects of chemotherapy. So there are bad side effects, really bad side effects of chemotherapy and radiotherapy, like nausea, vomiting, neurological trouble, paralysis, so many other diseases. You are all aware of the side effects. I should not talk about it. So is there any chance that homeopathy can affect? Another very valid point. There might be people sitting there with a skeptical mind saying that, okay, everything is good. Can you show me some evidence-based cases where, you have seen that homeopathy has really helped patients? So I really appreciate these questions. And ultimately, what really to expect from homeopathy in terms of cancer patients? A general question. So let me go ahead. We have many documented cases right now, but what I'm going to do is that I have selected few of them, maybe 4 or 5, and I will show you some results before and after, evidence-based cases with the reports. Of course, I'm not going to talk about the patient because of the privacy, but I'm going to show you. Let us look at some cases which have been benefited through homeopathy. This is a case of metastatic hepatocellular carcinoma, which we were treating, and okay, let us read the diagnosis first. Possibility of hepatocellular carcinoma, hepatic vein invasion, lymph node, secondaries in renal, ascites, affection. So you can see there was liver involved, there was lung involved, even the kidneys were involved. Acute kidney injury, and patient was in a very bad state. It was suddenly diagnosed, and there was no chance of even giving a chemo or radio. They suggested, but patient was so weak and debilitated that the relatives decided that we should not go for that. And hence, the search for some alternative therapies began, and somehow they came in contact with me, and we started the treatment. And these are the reports after the treatment. This was, I think, 3 or 4 months after the first report. She got started feeling better. And this patient was only on homeopathy. There was no conventional methods used. Basal lung shows good resolution with complete recovery of basal lungs. Only tiny ones are seen in the left node. And after that, patient went. She said, "I will not do any investigation." Physically, emotionally, she became very stable. And ultimately, maybe after 8 months or something, we repeated. We said, at least do sonography. And in sonography also, you can see there are no focal lesions in the liver. And this patient is right now with us for more than, I think this is 7th year, where they had said maybe 3, 4, maybe 6 months probably, but 7, 8 years. She's working fine. She started her own business. Everything is great. There's another case of CA rectum. CA rectum is very common nowadays, and you'll get many patients with these cases. Okay. Now let me give you a background of this case. This case was, it was a colleague's father's case, and definitely they went for surgery. They went for surgery and they removed the tumor, but there were metastases. There were some lymph nodes in the surrounding involved, and they suggested you do chemotherapy. But the patient was very old, and being a doctor, the doctor was doctor, so she knew the side effects of chemotherapy, and they decided that he will not be able to take chemotherapy. Hence they came to us. They said, is there a possibility that we have done surgery, but we don't want chemotherapy? Is there a possibility that you can give something in homeopathy and we can arrest the growth of cancer cells? And that was the objective of this case, and we started the treatment. So diagnosed case of CA rectum, adenocarcinoma of rectum. So you can see the report. Okay. Biopsy shows, and then the later one, the end report was biopsy shows microscopic features consistent with acute colitis and mild epithelial. This is another case. The small girl, I think 6-7 years lady, she came and she was having hypopharynx tumor, high-grade malignant tumor in the epithelioid and a neurodectal phenotype. It's a very difficult kind of, very unique kind of cancer she was having in the hypopharynx. They went for chemotherapy and other stuffs, and they did everything. Everything was okay. Within few months, the cancer recurred. In the same place, cancer recurred, and in a bigger form it recurred. And they were not sure whether what has to be done. And that's how they came to us, that after recurrence is there, so much chemotherapy and everything is taken. Is there any possibility that can you help us? And we started on homeopathic medicines after that. So you can see high-grade malignant tumors with epithelial and neurodectal phenotype. Case of hypopharyngeal sarcoma. And this is investigation after this patient we treated for, I think, around 1 year we treated this patient. We followed every step, and in all the acutes and every problem we were there, we helped the patient. And ultimately, no recurrent mass in the posterior pharynx wall. And the child is now happily living, very good in terms of talking, living life. She's studying, everything is great. Okay, so we are very happy with this result. Another case I will share with you is a bladder tumor. Okay, this patient came to us, very old guy, again old guy, and they also came to us that we don't want to go for surgery and other stuffs. Can you do something for us? We started the treatment. You can see urinary bladder lesions, approximately measures. Of course, this was not a metastatic cancer; it was a benign growth. And ultimately, if you can see, this is the investigation of a report after the treatment, and they say that urinary bladder has a polyp. So the tumor became polyp according to them, and ultimately, No evidence, no evidence. And okay. This is the last case which I want to share with you, and from this case we'll go ahead and understand the dynamics that plays behind cancer cells and the disease that we have. So let us look at this case. This is Dr. Sarkar's case, my mentor, my guru, and this is what I learned. This I learned from him, and I saw this case, and I've been studying this case very nicely. So let us see a case of ovarian cancer with metastasis. Patient 55 years female. Diagnosis: CA ovary. So we started the treatment, and as you can see, there are some cancer markers. CA 125 is a cancer marker for ovarian cancer. And these are the normal ranges. It should be between that. When she came to us, it was 710. Then it became 162. Then it came down to 102. And then 43. It was a really good progress. The patient was improving. And then suddenly what we found in December, it became to 97. It increased. What happened here? And then when investigated and when we looked into the life of the patient, what was found that there was a great emotional trauma, and because of this emotional trauma, CA 125 raised it. An appropriate homeopathic medicine was given at that time, and afterwards you can see subsequently it has been increasing, it was decreasing. So remember this, I'm going to come back to this emotional trauma. So you can see a patient who is on treatment, but in between some exciting cause comes, some mental stress comes, some emotional turmoil comes, and the cancer cells increase. These are the reports, okay, which I showed you in the slide, but of course you can see in the reports. I'll go a little faster. This was a time when emotional trauma came up and it increased. The mental effect on tumor marker. Very important to note here is that we are only looking outside. This is the cell, this is the tumor, this is, structural changes, but we are not looking beyond structural changes. There are so many aspects involved before the tumor cells even begin to form. What happens before tumor cells have formed? There are a lot of aspects, and we are going to talk about it. One of the effect is the mental effect, the emotional instabilities that we go through, the stresses that we go through in our lives. It has got immense effect on the tumor marker cells. This was just after taking homeopathic medicine, and drastically it came down. And hence, till now, the patient is living a great life. Lifestyle is good. So let us talk about causes. Let us talk about the causes. Before we try to understand what can help, what cannot help, it's not a question of homeopathy, Ayurveda, allopathy, or some allied therapy. It's not a question of the therapies. It's a question of we need to understand what causes cancer or any other diseases. Specifically, if we talk about cancer, the first cause, the most important one that we need to address, that we need to look into it, is the emotional causes. Everybody of us go through a lot of difficulties in life. We go through a lot of challenges in life. And you know what? Emotion plays a very big role. If you're healthy, your emotions you can manage and get over it. But you'll find you can look at your own life. You can just close your eyes and you can just sometimes sit and look at the patterns, the emotions that come up, the patterns that come up in different situations. And you will find very importantly that there are few patterns, maybe anger, grief, sadness, being reserved, sensitive. There are some patterns that is always there and you are stuck with that pattern. In every situation, you will find the same pattern coming up again and again. You'll get patients, you'll get people who get emotionally disturbed with a situation which is very trivial. But it affects them so badly that it remains, it stays with them. The situation passes on, but it stays with them for a lifelong time. And definitely these are the few causes of cancers. Hereditary causes, definitely. When we read scientifically about cancers, they say that it is a genetic problem, there's some mutation, chromosomal problem, and all those things. But in homeopathy, if you look, if you have encountered an homeopath, right, you'll always observe that. You'll always observe that. Uh, okay, you'll always observe that a homeopath always asks you, "Tell me the diseases you have suffered in past. Tell me the diseases you have suffered in past. Tell me the diseases that your family has suffered in the past. Your family history, your mother, your father's side, your uncles. Is there any pattern? Has anybody suffered from cancers? Has anybody suffered from some major illnesses?" So what is this? What are we looking at for? So we are looking at not at the genetic level, but we are also looking at a very bigger level. Definitely we have seen that there are some patterns which has effects. If there is a past history of lot many diseases, that also could be one of the cause of the disease that you're suffering. It has to be addressed. So we have a medicines to take care of it. Maybe I can share you one case here. It is not about cancer, but it is about a neurological problem. I'm still treating that child. Very old child, okay. Maybe she came when she was, I think, 4 or 5 years of age, but she looked very small, okay, smaller than her age. And the complaint that she came with was she was having lot of convulsions, okay, lot of convulsions, even 10, 12 convulsions a day, very bad convulsions, and very very poor chap. People who work on wages, he came. We started the medication, but nothing was happening. I think 6-8 months it kept on happening, nothing was happening. And we kept on asking about the past history and the diseases and other stuffs. And you know what? I think after 6-8 months, I asked him to get the vaccination file, and he brought a vaccination file, and I asked him specifically, is there any vaccine which he gave and after that you found some bad effects? And he pointed out one vaccine. He was an illiterate guy, but he pointed out the month, and that month was measles vaccine. I don't know how to correlate and how to answer this question. Measles vaccine was given, and after that the child started slowing down, debility started, weakness started, all those stuff slowly started. Now how should we tackle this? And we have medicines to nullify this effect, and we gave that medicine. And after that medicine, I saw that patient. I've been following every month, and last 3-4 months before I had been there, the patient is walking, convulsions have reduced 90%, and drastic changes have come in. So we are talking about emotional causes, but also there are some hereditary patterns. There are some drug-induced chemicals in our food which have been injected, which have been taken in our body, which can affect us. We have to look into, there are some females, take so many hormone pills. You have no idea what hormone pills can go inside and cause trouble. I have one patient. It's a very beautiful case. Again, a case of rectum. A lady comes from very old, I think 72, 73 years of age. She comes from a village, Maharashtrian lady. And language trouble, all those difficulties. It was difficult for me to even take the case and understand what's happening there. I got one history very strong in her, 72 years of age, since the age of 21 or 22. She's continuously taking painkillers whenever there is a trouble. Even little ache she pops in the pill. So you can imagine from that, around 50 years, 60 years have passed, how many painkillers she has taken. And of course, that was one of the reasons. Multiple reasons were there, but this was one of the reasons that we found out that this could also lead to the deformity that she's having. And we gave a medicine. We have some medicines to nullify these effects. And I'm following this case. This is, I think, third year right now. Within 3 or 4 months, bleeding and everything stopped. I'm not giving any medicine right now to her. So this could also be one of the causes, right? Of course, you cannot find out which can affect, which cannot. A homeopath, your nearby local homeopath who is working on these cases, has a real knowledge about to dig into the cause and get the cause and effect ratio. But you as an individual should also be careful about these things. You should also think about the drugs that you're taking. Very nicely, we take paracetamol, crocin, anything happens. But you have no understanding that the paracetamol, crocin tablet has such a bad effect on liver. It's a small tablet. So these are certain histories that we go back and look into the histories of the diseases, the drugs that has been taken. There could be, you can be residing in an area where some type of chemical is very prominent in your water, in your surrounding. That could also become a part of it. So homeopathy has some remedies to nullify these effects. Now there can come a question, basically, like we talk about this allopathic drug. So many people are taking allopathy, but how come only few are affecting? So many people are getting stress. Everybody is in stress. You say everybody in stress, then how come this only few people are getting diseases? And now I come to another point. Definitely stress. But now I have come to another very important part of homeopathy that is called individuality. This is what we have to understand. What we do in homeopathy, like if you go after listening to this talk, you start referring patients to homeopaths, and you start asking, if you start asking homeopaths, tell me, sometimes even doctors ask me, I have this diagnosis, can you tell me 10 remedies out for this? My dear friends, homeopathy has no specifics. We have no remedy for your disease. If you go to any homeopath and you ask, can you treat my cough and cold? He'll say, no, I cannot treat your cough and cold. I do not have any medicine for your disease, your name of the disease and nosology, but I have a remedy for yourself. I have a remedy for you. What does homeopathy focus on? It is you. You means individuality. If you get time today, look into yourself. You'll understand that you are actually an individual entity. You are completely different from others in every aspect. Might it be emotions, the way you react to the emotions, anger, sensitivity, coping up mechanism, how do you manage stresses? Yesterday, I can narrate you one very beautiful case, yesterday's case. A guy from a village came to me. 5 years, since 5 years, he's coughing. Continuously, he's coughing. He went to allopaths, anti-tubercular medicines given, anti-cough medicine given. Everything is been done. 5 years. And started with cough, entire tubercular regime has been followed. And whatever was there in allopathy, everything is given. His cough is not gone. And he comes to me and says, can you do something? I heard homeopathy can do something. 5 years, this guy is troubled with cough. I went back into his past history, and you know what I found out? That there was an incident when he had gone out. The cough started before he had gone to a marriage. It was hot season. He came back home, and in that hot, he drank lassi. The cold lassi he drank. And after that, he slept. And after sleeping 4 hours, fever started, and he started getting cough. That was the cause. After that, the disease started. So we have a medicine for that. When you're very hot and you take something cold, and you get some respiratory trouble. Just 1 week, entire cough and everything is gone. So what is this? Then the question comes that you'll ask, oh, everybody goes out and gets wet in rain. There are so many people who are playing cricket. You play games and then you drink cold drink. Nothing happens, right? You are absolutely correct. That is called individuality. You can make stand people and start insulting 10 people. All of them will not get affected, but one people will get so much reprimanded and affected that, after that, he'll stop talking, he'll stop going out, he'll become sad, gloomy, melancholy, everything will happen. So what is this? If you look at this pattern, this is called individuality. So we are an individual entity, and that's how we react to different kinds of stresses, different kinds of the backgrounds that we are born with, the soil that we call, the hereditary pattern. That is why we react with different kinds of chemicals. Hence, it's not just cancer. If we look at a disease per se, there cannot be a medicine for a disease name. There has to be a medicine for individuality. How do you feel in a situation? How do you react in a situation? What are your symptoms in the situation? Everything is different. A simple patient comes with fever. Sometimes, people say that homeopathy is slow. It's not slow. If you get a right symptom, it's not homeopathy. There's no science faster than homeopathy. If you look at your own pattern, in fever, 10 people gets fever. Everybody's fever is different. The chill, the heat, the way eating, drinking, everything is different. So individuality is the key. That is what we focus on. So let us take a chance. With this understanding, it was just to give you a general idea about homeopathic treatment. So what do we focus here is that homeopathic science only deals with individuality. So we are focusing basically on the individual. Hence, when you go to a homeopath, he is not going to prescribe you in 5-10 minutes. He's going to take a lot of time to look into it, to analyze you, to look different aspects of you. And we find out a remedy which is tailor-made remedy for you. Of course, there are a lot of chances of changing the remedy in difficult crisis situation. Even in crisis, we look out for the original symptoms that you get. This is the way we approach in our cancer cases. I hope I have given you a general idea about the human psyche and emotions and the problems that we face. Cancer is a big name, dreaded name, feared. No? I call it a monster. But everybody is not going to get cancer. And whoever is getting cancer, generally, what you need to understand is, we need to understand the inside feelings and emotions and the troubles and the other aspects of the individuality. If whatever pathy it is, if it addresses that thing, if it addresses that part of the individuality, definitely there are a lot of chances that we can really help that patient. Cancer is a difficult subject. I'm again telling you, I'm not here to brag about ourselves and homeopathy, but I'm just trying to tell you that yes, we have some answers for it. We can show you many cases where even in the dreaded diseases, even in the last stages, there are beautiful remedies that we have got which can really help the patient even to die in a soothing manner. We are also working on it. We are also struggling. We want to get more and more results. But definitely there is a lot of, that's what I can conclude my topic right now, that there's a lot of hope. This small topic, this small talk was just to give you a glimpse, basically to show you some evidences and give you a small glimpse that how homeopathy works and how homeopathy can become an adjuvant therapy. I want to address one more question here. One side we say that homeopathy has no effect, but other side, when a patient goes to an oncologist, and oncology suggests, you take this, and even if he by mistakenly says that I'm going to take homeopathy, many doctors, what they say, don't start now. It can get mixed. One side you say homeopathy is a placebo, it doesn't work. Other side, then why you're feared? Why I've raised this question is that whether I'm an allopath, whether I'm a homeopath, whether I'm an Ayurved, I am first a doctor. I'm first a healer. And how can I take chances in cancer? So you as a patient, you as a society member, when you get these, you encounter these troubles in your family, relatives, please look into the side effects, please look into the study materials, go through it. But whatever you do, I would urge to you that even as an adjuvant therapy, you should begin homeopathy. The problem that we are facing right now is that we get patients at a very end stages when everything is completely gone. The homeopathy doesn't come to their side. I know that their suffering is too much, but homeopathy doesn't come to their side that, okay, we are doing this conventional medicine, let us start with something. Maybe because lack of knowledge, maybe because lack of faith that they have. But I would urge to all people that even I can see lot many doctors, I would urge that take up the cases in the beginning stages. And the decision about chemotherapy and other stuffs can be taken on looking at the case and what exactly has to be done. But in whatever situation is there, all the people, all non-homeopathic, non-medicos, I would urge that please get hold of a homeopath, because a homeopath will remain with you till the end. And I pray to God that definitely majority of people who are suffering, He gives some more wisdom to our people so that we can help this human suffering which is rampant in our society. With this connotation, I would like to end my topic. I hope that, if you have some general question, you can put. I have got more 5 minutes. If there is a specific question, let me show you something. You can maybe write it to me. I'll show you then. I'm sharing here my number and email ID. These are my numbers and email ID. If you have any specific questions, of course, don't ask general question, but if there's any specific question or you need some help in some cases, definitely we are there. Whatever best we can do, we will do it. So do we have any question? Okay, there's one question Dr. Raksha has asked, microwave food items. I think you are homeopath, right? Yeah. Microwave food items, alumina cooking. Okay. Can it affect? Okay, very good question. I can answer this question, but I would like you to read something. Have you heard grimmer? I'm typing it. Can I type here? Grimmer. नहीं जाएगा. Okay, you can write it down. Grimmer. 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 Grimmer was a very good author, a very good homeopath. He was a student of Master Kent. He has done extensive work on cancers basically. And I would like you to read his articles. And this question answer definitely you'll get. In short, I can answer that if you're thinking of alumina cooking problem, toxicity, read the toxicity of alumina. Read the toxicity of alumina. If those symptoms are there in the patient of alumina toxicity, definitely what you can do is that you can use alumina, our alumina, in a potency form, dynamic level, as a nullifying agent. But of course, the symptoms has to be there. But I would urge that please read Grimmer. Okay. These are successful cases. Definitely, we are sharing only successful cases. Somebody is asking about the ratio. It's a very difficult case. It's a very difficult question to answer because ratio is very We have not found out exact ratio. And in fact, even if you go in allopathic science, nobody can give you exact ratio of any chemotherapy, that this is the ratio, this is how this many people can get better. Generally, but what you can do is that, what we have seen in our cases, definitely we have a lot of failures. I'm not saying that we don't have failures and whoever comes to us, goes with happy smile. No. I know the pain and suffering, how much I have suffered with my patients, because it's not just patient who suffer. But definitely there is some hope. Few cases get better depending on the system, depending on so many different aspects of it. So that's how it is. Can you explain regarding pain management? Doctor, right? Okay, from Chennai. Pain management, what I would suggest basically is that you should get first your skill sets right. Skill sets of managing your classical case taking has to be very good. BBCR and Kent and Fatak. BBCR, Kent and Fatak. Listen to me. BBCR, Kent and Fatak should be well versed. You should be complete. You should know exactly all the rubrics, all the things. You should be well versed with BBCR, Kent and Fatak, particular rubrics. I'm not talking mind rubrics. Even Kent repertory, we focus more on mind. But I'll tell you guys, we forget that there are so many different chapters and beautiful rubrics are given there. There's a very good book by Bhanu Desai. Bhanu Desai, he has extensively worked on how to study and learn about BBCR. I have learned a lot from it. You can get it online, VJN somewhere. Bhanu Desai, BHANU and Desai. You can definitely look into that. So if you can get your repertory proper and study regularly your Mater Medica, because nothing is more than that, right? Your Mater Medica and your repertory, and look for keynote symptoms. Look for location, sensation, modality, right kind of things. And okay, I'll tell you what my guru, my sir, Dr. Sarkar always tells me. When you're dealing with cancer, don't look at cancer as if it is a chronic case. He says that don't look at cancer as if it is a chronic case. Look at cancer as if it is an acute case. Because there are multiple layers. Every day the symptoms are changing. You cannot look at it as a chronic case. Look at it as an acute case and take present predominant totality. Remove one layer, then go to another layer, then another layer. That's how you go ahead, and you can maybe slowly the entire picture, which is morph picture, can get clear, and maybe you can come to the right remedy later on. But you have to treat cancers as an acute disease, because you have to be always on your toes. Pain, bleeding, asphyxia, so many troubles come along. I've shared my contact number. Somebody has asked me. Yeah. Everyone. Okay. I'll just type it down here so that it becomes easy for you. Any more questions? Then you can say. You can gmail.com. You can contact me on this 77-383-2294. Yeah. Can homeopathy work along with allopathy, or it needs to be taken on a standalone basis? Again, I said it is a very difficult question. I think it's a doctor or what? Who is it? Tilak. Okay, Tilak. What we can do is that you need to get educated first. Okay. What I suggest to my patient, I explain them about the hazards of the chemotherapy. That's why you need to understand which are the protocols that every disease is following. What I suggest them, I explain them the hazards. I explain them the hazards of all these therapies, and the patient has to take a decision on that. Whatever decision patient takes, we start homeopathy at that time. Because I'll tell you the fact, when you go through these treatments, slowly, after a while, there a time comes. Okay, I'm not telling that there are no cures and people are not benefiting out of conventional method. Definitely. But there are some time comes when chemotherapy and radiotherapy creates so much havoc in patient's life that patient himself says that I don't want to take those treatments, let me die. But of course, there can be some patients who can come and say that I don't want chemotherapy. Like I shared you the cases, the old people's cases. So the age, in fact, the age and the economy, the personality, the patient, the body's immunity, how much it is. It also depends on that if he can take chemo and radiotherapy. So whether alone or adjuvant, both ways you can take, but definitely you should start. One die not of cancer, but fear of cancer, resentment, cause to read book, Dr. Louis Hay. Definitely you can read, no problem. Anything else? So guys, it was nice talking to you all, and I've really enjoyed it, and I hope that I did my justice to everybody. And if there's anything, definitely you can write to us, and whatever best we can do, we can help you. Okay, so thank you very much. Bye.